Over 300 million people across India drink tulsi tea every single day. Holy basil, known as tulsi in Ayurvedic medicine, has been used for more than 3,000 years, and it is classified as an adaptogen, a substance that helps your body resist and recover from both physical and psychological stress. That sounds vague until you see the clinical data. In a randomized, double-blind trial published in Evidence-Based Complementary and Alternative Medicine, participants who took 250 milligrams of holy basil per day for 8 weeks showed significantly reduced hair cortisol levels compared to placebo. Hair cortisol is important because it is not a snapshot of one bad afternoon. It reflects months of accumulated stress hormone baked into your biology. A separate 30-day trial found improved attention, improved working memory, and measurably lower salivary cortisol in people taking holy basil extract. Cortisol is the hormone that keeps you staring at the ceiling at 2 in the morning, replaying conversations. It is the hormone that raises your blood pressure and blood sugar under chronic stress, and it is the hormone that hospitals address with benzodiazepines and beta blockers, drugs that generate billable prescriptions and recurring pharmacy visits. Holy basil is not a patentable molecule. Adaptogens do not fit the one pill, one diagnosis model that modern medicine runs on, so the system simply looks past them. Growing holy basil indoors is straightforward. It wants a south-facing window, warm temperatures, and moist soil that never sits waterlogged. Pinch the flower buds regularly to keep the plant bushy and productive, then brew the fresh leaves directly into tea. But stress is only the first problem on the list, and the next plant addresses something far more visible. A systematic review published in the Iranian Journal of Medical Sciences examined 23 separate clinical trials on aloe vera and wound healing. 23 trials. The review found aloe vera effective for burn wounds, post-operative surgical wounds, and chronic skin ulcers. A meta-analysis focusing specifically on burn patients found that aloe vera shortened healing time by nearly 9 days compared to conventional treatment. To put that in perspective, 9 days in wound care is the difference between weeks of painful dressing changes and returning to normal life. It is not a marginal improvement. It is a clinically significant acceleration of the body's healing process. So why does your hospital use standardized wound care products instead? Because those products come with NDC numbers, liability coverage, and insurance billing codes. A plant sitting on a shelf does not generate a billable procedure. It does not require a follow-up appointment. It does not feed the revenue cycle. Aloe vera is also one of the most forgiving houseplants you will ever own. Place it in bright, indirect light. Water it only when the soil is completely bone dry, and it will survive for years with almost zero attention. When you need it, snap off a lower leaf and apply the clear gel directly to minor burns, small cuts, or cracked, dry skin. It is a living first aid kit that asks almost nothing in return. Now, the next herb on this list surprised me more than any of the others because it works through the exact same mechanism as a class of pharmaceutical drugs prescribed for Alzheimer's disease. A randomized controlled trial published in Complementary Therapies and Clinical Practice tested 500 milligrams of rosemary taken twice daily for 1 month. Participants showed significantly improved prospective memory, the ability to remember to do things in the future, and retrospective memory, the ability to recall past events. The same trial documented reduced anxiety, reduced depression scores, and improved sleep quality, all from a kitchen herb most people only associate with roasted potatoes. In elderly adults, a study published in the Journal of Medicinal Food found that even a low dose of 750 milligrams significantly boosted the speed of memory compared to placebo. Here is what makes this remarkable. Rosemary works through cholinesterase inhibition. That is the exact same biochemical mechanism used by donepezil and rivastigmine, pharmaceutical drugs prescribed for Alzheimer's patients. The mechanism is identical. The difference is that one comes with a prescription pad and a $500 monthly price tag, and the other grows in a pot on your kitchen counter. Cognitive decline is treated pharmacologically in hospitals because dietary herbs are simply not part of the clinical workflow. There is no billing code for recommending rosemary tea, so it never enters the conversation. Rosemary is extremely hardy on a windowsill. It prefers a sunny, dry location. Let the soil dry out completely between waterings, and clip sprigs for cooking, or steep them in hot water for a tea that costs nothing after the initial plant purchase. But there is a catch with cognitive health, because one of the biggest drivers of brain fog is not aging at all. It is anxiety. And the next plant on this list targets anxiety through a mechanism that will sound very familiar if you have ever been prescribed a benzodiazepine. In the United States, over 40 million adults carry a diagnosis of an anxiety disorder, making it the most common mental health condition in the country. A landmark randomized clinical trial published in Phytomedicine tested 1,500 milligrams of pharmaceutical-grade chamomile extract daily over 38 weeks. This was not a weekend study. This was nearly 10 months of rigorous clinical observation. The results showed significant reduction in moderate to severe generalized anxiety disorder symptoms, not mild nervousness, clinically diagnosed generalized anxiety disorder. A meta-analysis of 10 studies covering 772 participants confirmed significant improvements in sleep quality from chamomile supplementation. The compound responsible is apigenin, a flavonoid that binds to the same GABA receptors in your brain as benzodiazepines like Valium and Xanax. The critical difference is that apigenin does not carry the risk of physical dependence, withdrawal seizures, or the addiction potential that makes benzodiazepines among the most dangerous drugs to discontinue abruptly. Benzodiazepines and selective serotonin reuptake inhibitors are the standard of care in psychiatry. They generate billable prescriptions, they require monitoring appointments, and they create long-term pharmaceutical customers. Chamomile tea does none of those things. It does not require a DEA number to dispense. It does not create recurring revenue. It just works quietly, which is exactly why nobody with a financial stake in your treatment is going to bring it up. Chamomile grows easily in a wide, shallow pot on a windowsill. It needs at least 4 hours of direct sunlight daily. Harvest the flowers when they are fully open, dry them on a tray, and brew them into tea that addresses the same symptoms targeted by some of the most widely prescribed drugs in America. And the fifth plant on this list does something none of the others do quite as well. It calms you down and sharpens your focus at the same time. Lemon balm has been used medicinally in Europe since at least the Middle Ages. Monks grew it in monastery gardens specifically for its calming properties, and modern science has confirmed what centuries of use already demonstrated. A meta-analysis published in Phytotherapy Research found that lemon balm significantly improved both anxiety and depression scores compared to placebo across multiple clinical trials. But here is what sets it apart. A double-blind, placebo-controlled trial published in the European Journal of Integrative Medicine studied patients undergoing coronary artery bypass surgery. These were not people dealing with mild stress. These were cardiac surgery patients facing life-threatening procedures, and lemon balm still produced measurable reductions in emotional distress and noticeable improvements in sleep. A 2023 study published in Frontiers in Pharmacology confirmed calming effects and improved sleep conditions in healthy adults with emotional distress, and the European Scientific Cooperative on Phytotherapy, the official European authority on herbal medicine, formally recommends lemon balm for mild anxiety, mental stress, restlessness, and irritability. In hospitals, mild mood complaints are either dismissed entirely or treated with medication. There is no middle ground in the clinical model because there is no billing code for telling a patient to drink lemon balm tea. No insurance reimbursement. No follow-up appointment generated. Lemon balm is one of the easiest herbs to grow indoors. It tolerates lower light conditions than most herbs, keeps growing in modest windowsill situations, and with lightly moist soil, it will produce aggressively. One single pot will supply enough leaves for daily tea through the entire winter. Crush fresh leaves into cold water on warm afternoons, or steep them in hot water for a tea that addresses anxiety without a prescription. Now, step back and look at the pattern. 5 plants addressing 5 of the most common reasons people visit a doctor: chronic stress, wounds and skin problems, cognitive decline, anxiety, sleep disruption. Every single one backed by randomized, placebo-controlled clinical trials published in peer-reviewed medical journals. Every single one available for the cost of a small plant or a packet of seeds. Every single one capable of thriving on a windowsill through the winter months, exactly when seasonal depression and illness peak. The pharmaceutical industry generated over $600 billion in United States revenue last year. That revenue depends on patients who need prescriptions filled every single month. A windowsill garden does not generate monthly revenue. It does not require insurance authorization. It does not create recurring customers. No conspiracy is required to explain why hospitals do not mention these plants. The system simply does not see what it cannot bill for. Research funding follows patents. Patents require novel molecules. Herbs that have grown wild for thousands of years cannot be patented. The knowledge is not hidden. It is published in medical journals. It is practiced by hundreds of millions of people across Asia, Europe, and South America. It simply does not appear in the 10-minute appointment where a physician must diagnose, prescribe, and document before moving to the next patient. One thing needs to be absolutely clear. These 5 herbs are complementary tools. They are not replacements for medical treatment or prescribed medication. Holy basil and chamomile can interact with blood thinners, diabetes medications, and sedatives. If you are currently taking any medication, consult your healthcare provider before adding herbal supplements to your routine. But the conversation itself matters. Asking your doctor about evidence-based herbal options is not alternative medicine. It is informed medicine. 5 plants, 5 windowsill pots, an entire winter of growth, and a medicine cabinet that costs less than a single pharmacy copay. The clinical trials exist. The plants are available at any garden center. The only question left is whether you are going to grow them. If this changed the way you think about what belongs on your windowsill, you might want to explore what other overlooked plants can do for your health. That rabbit hole goes deeper than you would expect.